issues that prevail in India. We are basically trying to focus on different social issues that is prevailing in India. But before going to any social issue, first I would like to know, acknowledge you all that the yesterday train mishap that happened in Odisha, about 300 valuable life were lost and more than 1,000 people are injured. So for that, I would like to request you all to have a 1 minute at least condolence for the people, those who have lost their family members and those who are injured and suffering in the hospital. So for that, we'll do 1 minute condolence. After that, we'll start our session. Okay, so thank you all. So it was one of the biggest tragic accident in last 1 century. Some people are saying. Okay, so uh, we'll go to today's session. Basically, we have with us Dr. Lakshmana G, and to introduce our speaker today with us, Dr. Renuka Kumar, academic consultant from Directorate of Distance and Continuing Education, Utkal University, Odisha. Now I request Dr. Renuka Kumar to introduce our speaker and continue the lecture.
Thank you,
Over to
Pradeep sir. Dear friends, a very good evening to all of you. I'm Dr. Renuka Kumar, Academic Consultant, Department of Social Work, Distance and Continuing Education, Utkal University, Odisha. I welcome you all to the Gyanalok Saturday lecture series on social development issues and role of development professionals, jointly organized by Gyanalok Trust and the Department of Social Work, DDCE, Utkal University, Odisha. Today we have with us an eminent speaker, Dr. Lakshmana G. Dr. Lakshmana G is currently working as an associate professor, Department of Social Work, Central University of Karnataka. He has completed his Masters in Social Work from Bangalore University, an MPhil and PhD from National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore. Dr. Lakshmana has over 12 years of professional experience in the field of teaching and research and published more than 30 research articles in the journals of national and international reputes published by world's leading publishers. Additionally, he has developed 2 book modules on working with children who are addicted to substances. As a principal investigator, he has completed 8 research projects funded by Government of Karnataka, UGC, Canara Bank, etc. Dr. Lakshmana has been involved in teaching and research in the areas of psychosocial intervention with families and children, addiction medicine, community care and mental health, elderly care, corporate social responsibility, and so on. Under his able guidance, two PhD scholars and one MPhil scholar have been awarded, and five are pursuing. He has visited the countries like Australia, Indonesia, China, Nepal, and Sri Lanka to attend seminar and deliver lecture. As resource person, he has delivered more than 50 lectures and organized more than 60 workshops and training programs. Dr. Lakshmana has worked as an additional member of National Journal of Professional Social Work and reviewer of British Journal of Social Work, Journal of Biomedicine Research International, Global Journal of Health Science, and Journal of Children and Youth Services Review. Dr. Lakshmana is a life member of International Association of School Social Work, Asian and Pacific Association for Social Work Education, Indian Society of Professional Social Work, National Association of Professional Social Workers in India, and Karnataka Association of Professional Social Workers. He also served as an executive committee member of Indian Society of Professional Social Work and Karnataka Association of Professional Social Workers. Out of his vast knowledge and experience, Dr. Lakshmana will deliver today on psychiatric social work, importance and objectives. On behalf of Gyanalok Trust and Department of Social Work DDCE Utkal University and all participants present in today's lecture, I welcome our speaker Dr. Lakshmana G and request to address the audience. Now it's your time, sir. Thank you.
Yeah, thank you, madam. Uh, I thank Pradeep Sahuji and Dr. Renuka Kumar madam for giving me an opportunity to share some of my thoughts on the topic psychiatric social work. As yeah, I'm sharing my PPT. Is it visible, Dr. Sahuji?
Yes, sir. It is visible. Yes.
Yeah. So, dear participants, today I am going to discuss
You
on
can make
psychiatric
it
social
full
work.
screen mode, sir. Actually, it is not full screen. You can make that full screen mode.
Now it is full screen. Yeah. Is
Okay.
it full screen now?
Uh, I think no, PPT mode, slide mode is not. Yeah. Yes, yes. Now it is. Yes.
Yeah. So today I will discuss on psychiatric social work, which is the one of the specialization or branch of social work or fields of social work, you can say. Basically, I will be covering yeah. The outline of the presentation is introduction, historical development of psychiatric social work, history of psychiatric social work in India, some few statistics on psychiatric social work and other members of the field of psychiatry, social work profession core values, problems in mental health, biopsychosocial model on mental health, social work methods in psychiatric social work, role of psychiatric social work, scope of psychiatric social work, challenges, global interventions, and conclusion. So this is coming to introduction. Psychiatric social work is a specialized type of medical social work that involves supporting, providing therapy to, and coordinating the care of individuals who are severely mentally ill and who require hospitalization or other type of intensive psychiatric help. This is the one view of is psychiatric social work. The essential purpose of psychiatric social work is to help the people with the problems of the mind or with the behavior problems, or we can say precisely the problems of mind and brain and their solutions. Basically, psychiatric social workers will be focusing on the psychosocial issues of the people who are having mental health issues as well as adjustmental problems. So when it comes to psychiatry, the application of the methods and the skills and techniques of social work in the field of psychiatry. So, what is psychiatry? If you see, psychiatry is a branch of medicine which deals with the issues of mental health. So, here we psychiatric social workers will try to apply our methods and our skills and techniques in the field of psychiatry to help individuals, groups, as well as family and the community. So according to Mental Health Act 2017, it defines psychiatric social worker means a person having a postgraduate degree in social work and a Master of Philosophy in Psychiatric Social Work obtained after completion of a full-time course of 2 years, which includes supervised clinical training from any university recognized by the University Grants Commission, established under the University Grants Commission Act 1956, or such recognized qualifications as may be prescribed. So this is what the Act 2017 Act says about psychiatric social work. But if you see the literature, as I said, broadly the definition has been given by R.K. Upadhyaya. It says that application of methods of social work and techniques and skills in the field of psychiatry or in the field of mental health is called psychiatric social workers. Okay. Psychiatric social work is a challenging and very demanding profession. So social workers in this field must work closely with individuals suffering from complex and hard to manage conditions, who are in deep emotional distress and or who may be a danger to themselves or others. So psychiatric social workers may also encounter difficulties in getting clients the resources and support they need to fully address their problems. However, some individuals gravitate to this work for its constant intellectual and professional challenges and for the opportunity to help deeply vulnerable populations. If you see historical development of psychiatric social work, we can corroborate with the history of social work in the globe. So we know that history of social work. If you see in US or in UK, we see that the hospital social work, they started to work in the field of health. So there we can observe, basically we started using our primary methods in the hospitals and especially with the persons who had mental illness. So in the beginning, the psychiatrists were interested to understand the personality of the patients in relation to their social environment, because personality is not developed, it is not develops only one day. It takes over a period of time, it evolves. So that is why they were interested to understand how social environment influences an individual's personality. So they appointed some agents for collecting the family background of the patients, and these agents collected case histories from the patient and acted as an intermediate between the patient and the family members. They were the pioneer social workers in the field of psychiatry, we can say. So as in 1905, Massachusetts General Hospital established social service department. Dr. Putham, who was in charge of the neurological clinic, appointed a full-time social worker in his clinic under his personal supervision. So in 1906, psychiatric social work was initiated at the Manhattan State Hospital in New York City by the New York State Charities Aid Association. Here, the psychiatric social workers visited patients' families to obtain collateral information needed by psychiatrists related to family background and past life experiences. Because we can see mental health is having close relationship with the family, our environment, as well as other community issues. That is why there was a need to understand the overall aspects of an individual. So that was the initial work which was given to psychiatric social workers. They just acted as aftercare agents, and clinics in United States began to employ social workers. The pioneer social workers and the aftercare agents inspired many people to act as social workers in the field of psychiatry. So they have established and they show the importance of collecting the following information and as well as the importance of collaborating with these various agencies. The term psychiatric social work was first used in the book The Kingdom of Evils by Dr. Ernest Sutherland and Dr. Mary C. Jarrett. The book reveals the scope and importance of psychiatric social work. In 1917, Mary Richmond, in her book Social Diagnosis, emphasized on the role of personality and society in influencing mental health of the people. Mary Richmond also written one more book, that is Good Neighbor. In Good Neighbor, she explains the relationships with the family as well as the community. So when the United States entered World War I, leaders of the psychiatric social work profession foresaw the need for providing care for the mentally ill in Army and Navy hospitals, and in 1918 initiated a training course for psychiatric social work at Smith College, Northampton, Mass. So here one of the important thing is, when this World War I happened, so much catastrophes happened, and there were so many people who passed away and their families were left out. And some of the soldiers who had been affected because of the war, some of them lost their limbs, some of them lost the ears, and they also had very bad experiences as well as emotional burden. So they needed some kind of the supportive therapy. So there the importance of psychiatric social workers came to force. So there social workers grabbed that opportunity and started the training. In 1920, William Halles started a child guidance clinic and he emphasized in the scope of psychiatric social workers. In child guidance setting, social workers begin to enjoy greater freedom of working. So they gain more preference in child guidance. In 1922, the American Association of Social Workers was formed initially. Initially, they were part of American Association of Hospital Workers. So in 1926, they separated from the association and considered as an independent body. So this you can see now. So from working independently or individually, they came together in the form of association. So they have got some kind of recognition through their body. From 1930, a new emphasis appeared within the family welfare agencies in account of families presenting with problems of emotional maladjustments in addition to financial needs. Thus, a large number of workers in the field of family welfare began to utilize knowledge from field of psychiatry to work as therapists to clients with psychotrophic problems. Most family welfare agencies started to employ psychiatric social workers and they started to give training to their staffs in mental health and social psychiatry. So this is one of the important things we can see, that the development of training in the field of psychiatric social work and psychiatry. In September 1942, the association requested a grant from Rockefeller and Foundation in order to accomplish two major objectives. One is to centralize data on personnel and vacancies in psychiatric social work, and second one to establish a more vital and immediate relationship with professional education for psychiatric social workers. This involved plans for recruiting students for psychiatric social work, for developing scholarship plans to finance students, and for channelizing new materials and areas of practice to the schools of social work. So if you see the history of psychiatric social work in India, the history of psychiatric social work in India began with the establishment of child guidance clinics by Sri Dorabji Tata Graduate School, Bombay in 1937. So here we have heard that Durgabai Deshmukh, who came back from US, she started initiating this, and the clinic was established to provide training facilities for postgraduate social work students. In 1938, a trained social worker was employed on a full-time basis. And in 1948, the Bore Committee recommended for the appointment of medical and psychiatric social workers. So this Bore Committee is one of the milestones in the field of health, mental health in India. So this committee has recommended to set up a mental health institute and other things. So as per this committee, All India Institute of Mental Health was set up in 1954, which became the National Institute of Mental Health and Neurosciences in 1974 at Bangalore. The first training program for primary healthcare was started in 1978 and 79 in one of the place called Samara. During 1978-84, Indian Council of Medical Research funded and conducted a multi-center collaborative project on severe mental morbidity in Bangalore, Baroda, Kolkata, and Patiala. Okay, so 1 minute, just there is some issue. Whether my slides are visible? Sahuji, my slides
Yes. Slide is visible, but now not in full screen mode.
Okay, please see that now. Just see. Is it visible now?
Yes, sir.
Yeah. Okay.
Yes, sir, visible.
Yeah. Thank you. So various training programs for psychiatrists, clinical psychologists, psychiatric social workers, and psychiatric nurses, primary care doctors were conducted at Sakalwara unit during 1981 and 82. Combating stigma and widening the social network of patients were regarded as one core element of successful rehabilitation programs. So during the last 50 years, so this is almost 70 years, activities have moved from care of mental ill to include prevention and promotion of mental health. Keeping with the reforms in community psychiatry, the first psychiatric mental health camp in India was organized in 1972 at Bagalkot, a taluk of Mysore. So in 1948, Yerwada Medical Hospital appointed a psychiatric social worker named Malati Ranade under the guidance of Dr. J.R. Banerjee. After that, JJ Hospital in Bombay employed a psychiatric social worker in 1950, and 1952, a specialized course in psychiatric social work was established. This was combined with medical social work, and it was called medical and psychiatric social work. So Dr. Sharada Menon, who was the superintendent of Madras Mental Health Hospital, helped the growth of psychiatric social work in South India. The Delhi School of Social Work introduced specialization in psychiatric social work in postgraduate training in social work in the year 1962. So followed by this, other institutions also started medical psychiatric social work specializations. You can see Bombay Tata, they had. Then again, Nirmal Niketan, they started, and again you can see in other universities, they also introduced the paper called psychiatric social work. So if you see the statistics, the importance of psychiatric social workers, we understand. As per the WHO, it says, it is the data of 2016, for 1 lakh population, there were only 0.3 psychiatrists, 0.12 nurses, psychiatric nurses, and 0.07 psychologists, and psychiatric social worker was 0.07. While the disabled number is about 3 psychiatrists and psychologists per lakh population. So see, this is the manpower. You can see that how much we have trained. WHO also estimates that about 7.5% Indians suffer from some mental disorders, and Lancet studies suggest that India's contribution to global studies, suicide deaths increased from 25% in 1990 to 36% in 2016 among women, and from 18.7% to 24% among men. WHO also estimates that in India, the economic loss due to mental health conditions between 2012 to 2030 is 1.03 trillion of 2010 dollars. So the basic idea why I added this slide is we have to understand the scope of psychiatric social work, or the importance of social work in the field of mental health. So this is the slides which estimates that 970 million people worldwide have a mental health or substance abuse disorders, and anxiety is the most common mental health in the illness in the world, affecting 284 million people. Okay, so you can see here anxiety, substance abuse, major depressive disorders, dysthymia, bipolar, dementia, schizophrenia, eating disorders. So, but now we can understand that these are the important things where we have to play important role. So the mission of social work profession is rooted in a set of core values. These are the values, as we know: one is service, social justice, dignity and worth of the person, importance of human relationships, integrity, and constellation of core values reflects what is unique to the social work profession and competence. So that is why our role in the field of mental health is very important, and it shows the importance in the 21st century. So what are the problems in the mental health field? If you see, there is a problem of stigma, and the mentally ill people are not treated at par with the so-called what we call normal people, and still a great part of the population believes in faith healing and traditional treatment. In some areas of the country, the priest is considered as the physician. So there is a role of this traditional healing, but for major mental disorders, there is a need of the modern treatment also. The number of institutions specialized in psychiatry is less. Absence of multidisciplinary team in big hospitals poses another problem. A number of professionals specialized in dealing with mental illness is less. So these are some of the problems we can see. And why the importance of psychiatric social work? If you see, medicine alone does not work always. So that is why psychiatric patients cannot be treated from medicine alone. So it requires multidisciplinary team effort. So who are the multidisciplinary team? So these are the following people includes multidisciplinary team, and the psychiatrist, psychiatric social workers, clinical psychologist, psychiatric nurse, so pharmacist, speech and language, pathologists, occupational therapists, physiotherapists, legal consultants. So all these people have their own role to play in the field of psychiatry. So when it comes to, if you see any hospitals, psychiatrists, psychiatric social worker, clinical psychologists and psychiatric nurses will have a core team will be there. Okay. So the biopsychosocial model of mental health, it says if a person wants to be healthy, then biologically you need to have stronger points socially and also psychologically. See, for example, if socially upbringing is having some difficulties, or the person is exposed to some kind of ill treatment, then he may get he is vulnerable for mental health issues. Same way, family, peer relationships, poverty, school, media, culture, works, stresses, traumas, and discrimination. All these things will lead to the problems. Same way in psychological beliefs, emotions, resilience, coping, emotions of a person's, how his behaviors are there, all those things. Okay, and again some biological factors also will contribute for the mental health. So overall, biopsychosocial model says there are biological issues, psychological issues, and social issues. If you want to address a treatment, then we need to include all biological, social, and psychological components. Then only the treatment and then only the person is complete. So this is the base for the treatment of mental health issues. So the social work methods used in psychiatric social work. So we use all methods, primary methods and secondary methods in the field of psychiatric social work. So primary methods has social casework, social group work, community organization. Secondary methods, social action, social welfare administration, social work, research. So before I discuss about the how we use this, let us see what are the objectives of psychiatric social. So if you see the objectives of psychiatric social work, the first one, if you take of all the people with particular attention to the needs of individual and who are having psychological and social issues. Empowerment of people who are vulnerable, oppressed and living in poverty. Focus on individual well-being in a social context and the well-being of society. So here, if the individual is healthy, then his family will be healthy. In turn, our society and community also will be healthy. So one of the objectives of social work is focus on individual well-being. So through that, enhance the well-being of family and the society. Attention to the environmental forces that create, contribute, and address problems in living. So what are the environmental forces which create problems individual and how that environmental adjustments can be done? So this is also one of the objectives. Next, promote social justice and social change with and all on behalf of individuals, families, groups, organizations, and communities. So focus on social justice, especially those who are having a mental health issues and also other adjustmental issues. Promote the responsiveness of organizations, communities, and other social institutions to individuals' needs and social problems. Enhance the capacity of people to address their own issues in terms of enhancing their mental health. What are the roles of psychiatrist social worker? So these are the roles we can classify clinical and non-clinical. So what are the roles in the clinical? See, when we work in hospital, a psychiatric social worker, first one we do is intake. Okay, so intake is, as we know, that casework. What we do casework? So casework, we work with individuals. So basically we work with individuals, we assess the capacities and also dysfunctions of the individual, and we will try to help the individual to adjust. So here, same thing, what we do, the process of casework will be applied. First process of casework here is intake. First we do the intake. So here we take the client. Next one is reception, accepting the client. So once that is done, diagnosis or analysis of the psychosocial. Here one important thing we have to keep in mind is psychosocial assessment. So here psychosocial assessment will focus on how the individual is there, how his psychological problem or psychiatric problem has been developed. It is not only in the field of psychiatry, in all the fields we focus. Okay, so here we assess we assess how the individuals aspects, family, community, and all other things contributed for problem, and how these things can be addressed. So it will be done through psychosocial assessment. So here not only present context, we also take historical things. For example, development. A person, how the person's developmental stages was there, and how his adjustment was there with the peer group, with the siblings. All those things will be done here. That is why the role of psychiatric social worker is crucial. So based on that, what are the factors contributing, psychosocial factors are contributing, will be identified. The next, treatment. So here psychiatrist will be focusing on medical part, whereas psychiatric social workers will be focusing on what are the psychosocial interventions can be done. So here psychosocial interventions will be using various psychosocial interventions in terms of casework, group work, committee organization, social action, research, as well as welfare administration. What is required? Based on that, we will derive the intervention. For example, individual is having adjustmental problems. Because of adjustmental problems, he is having difficulty, and he has developed some kind of anxiety, or he has developed some kind of adjustmental issues. So you focus on that and address. Okay, so you take casework here and you do it. Okay, same way, if there are issues in the family and couples are having issues, because of that the person has developed some kind of health issue, mental health issues. So then you work on adjustmental problems of the couple. Okay, so you are using family intervention. So same way, once the person is treated, he is going back. After he is going back, so what are the rehabilitation of patients? How it has to be done? So definitely, if the person is having minor mental health issues, then his interventions is limited. Whereas when the person is having major mental issues, how he has to be rehabilitated, how he has to be reintegrated to the family and community, that will be focused here. Okay, then follow aftercare will be done. Okay. Again, casework with patients and families will be done in clinical. When it comes to clinical or non-clinical, program planning and development, it is basically training and development. It's a community or outside how it has to be done. For example, industrial social work, same way we will be doing some training, capacity building training program for health workers or NGOs. So that will be done. Providing education and resources for the family and others. Administration of community services or programs, like taking up the empowerment programs or awareness programs in the communities. So we can see assessment of client needs for macro community programs or services. coordination or evaluation of service delivery, advocacy on behalf of persons or groups with unmet service needs. So here we take advocacy. So, you can see that we were working basically on community organization and social action models, analysis and development of social welfare policies. So it's a basically a social work method we are using a provision of training about community needs and problems will be done. So overall, you can see the scope of psychiatric social workers are unique and it is there in multi discipline or in many areas. One is public mental health. You can see public mental health people are employed in mental health, the DMHP. It's a district mental health programs we can see, and we are also having community community resource centers and community health centers. So our people are employed. Adult mental health. This is also one of the area where people work on adult mental health, especially with mental health of adults. Community teams. So we work in community teams for the empowerment and also working with the people in the field. Child and adolescent mental health teams. So enhancing the well-being and also addressing the issues of children and adolescents. Primary mental health care. So focusing on issues, basic issues. Tertiary mental health services, where you can see, tertiary mental health. So we have different mental health services. For example, PSC, primary health centers. So there we need only prevention aspects as well as the promotive aspects. When it comes to tertiary centers, like as I said, the mental health hospitals, mental health centers, there we need tertiary health centers. So there are tertiary mental health services where basically we'll be working on treating and rehabilitation and drug prevention programs in the community as well as the de-addiction centers. So we can work and different fields working. Perinatal services for mother and child health. Maternity support services. Geriatric mental health, working with the elderly on issues of elderly care and their mental health issues, adjustmental issues, retirement issues. Those issues will be handled. And indigenous communities on mental health and specialist services, especially when it comes to other for example, psychotherapy or psychosocial interventions we will be doing, and again, working on other models and therapies. What we learn different models. So coming to limitations for psychiatric social in current scenario, curriculum is based on the Western pattern, and sometimes it doesn't suit for Indian scenario. But now a lot of work is taking place in this field. Most of the psychiatrists and general doctors are not well aware of the role, importance, and the need of social workers. No functional identity properly, but others are properly defined. So there is a lot of gap, and because we also have few people in the field of psychiatric social work, so that is why manpower is very less. Problem of role ambiguity, because as I said, psychiatric field, the field of psychiatry is in multidisciplinary and interdisciplinary. So we have different people in the team. So sometimes the ambiguity is there. Lack of strong regulatory authority. So in India, we don't have regulatory authority. So though efforts are made, there is no regulatory authority. Whereas if you see the Western countries, there is a regulatory authority. If you want to call yourself as psychiatric social workers, you need to have a license. For example, LSW, licensed LCSW, licensed clinical social worker in USA, same thing in UK. That means regulatory is there. Nobody can call themselves as psychiatric social workers or mental health professionals unless they have a qualified professional degree. And low recognition in the society, ethical dilemmas are there, stigma and misconceptions are more, and again limited access and affordability, challenges of interdisciplinary teams, burnout and self-care, because they need to handle more patients and emotional issues. It also can be seen. If you see the global interventions, so WHO began when Constitution came into force, that is 1948 when WHO came in, they started working on health and mental health. So these are the things they are focusing on mental health in global action programs. That is increased country capacity, information for better decisions. They want to enhance advocacy against stigma and discrimination in the society, integrated policy and service development, enhanced public health research capacity. So they are focusing. There are so many NGOs working for in the field of mental health, and I have just listed here few organizations: Mindroot Foundation, the Banyan, Minds Foundation, SCARP is there, and Research, Jansa, Social Development Society, Whitespan Foundation for Mental Health. So now we can see Kadabams, so Samveda Society for Mental Health. So SCARP is there in Chennai. So there are various organizations are working for the mental health people. List of government mental health centers, if you see, there are right now there are 22 mental health hospitals which are offering MPhil in psychiatric social work in the country, especially in India. So I have listed few here: National Institute of Mental Health and Neurosciences, Central Institute of Psychiatry, Dharwad Institute of Mental Health and Neurosciences, Dharwad, Institute of Mental Health and Neurosciences, Kozhikode, Government Mental Health Center, Lokapriya Gopinath Bardoli Regional Institute of Mental Health, Institute of Human Behavior and Allied Sciences, Delhi. So there are other institutions have come up in the country. So one is there in Cuttack also. They are also offering mental health, and because a lot of emphasis has been given in 11th and 12th year plan, and Government of India has understood the importance of mental health, and they are investing a lot of funds, and a lot of development has been taken place in the field of mental health. If you see the national level in India, a lot of efforts have been made in the field of mental health. So the first draft of Mental Health Act was enacted in 1987, and initial attempts by the Indian Psychiatric Society to bring change was unsuccessful. But later you can see they could able to successfully bring out first National Mental Health Act in 1987, and National Mental Health Program was initiated in the country in 1982, which is a milestone in the field of mental health. And National Mental Health Policy was enacted in 2014, and the major on 2017, the National Mental Health Act 1987 was replaced with the Mental Health Care Act. Right? Now we also have Persons with Disability Act, which also addresses the issues of disability. You can see. Okay. So coming to conclusion, now as per the Mental Health Act, as I said, if you want to call ourselves as psychiatric social workers, then one must have MPhil in psychiatric social work. And in social work, we also have a paper medical psychiatric social work, and there is now from generic there is a movement throughout the world. There is a movement on going for specialization based. So now you can see medical and psychiatric social work is one of the field where we have a lot of scope to work in the field of health and mental health. Okay, as I said, the role of social workers, psychiatric social workers, are vast. So we work in a multidisciplinary team, and in various fields we work. One example I would like to give you, that if you take for example the field of addiction medicine or substance abuse, if you take, what is the role of psychiatric social worker? So here psychiatric social worker, the person in the clinic, what we do is actually when the person admits, we do psychosocial assessment. Psychosocial assessment will include his complete history from his childhood to present context, and how his previous experience or previous adjustment was there, how the disease has been developed. Okay, so that we will address. Then we will take that one. Okay, so later we focus on what are the issues of that individual, and we will do counseling and we will help. Okay, so yeah, there are various psychosocial interventions will be done here by psychiatric social workers. So we employ casework method, group work also will be employed. We call again call a group of patients and also family members. So we will have the structured interventions. There have been developed psychiatric social work interventions has been developed. Same way once the discharge happened, regular follow up and successfully reintegrating with the community will be done. So again, if you come to community organization, going to field and organizing interventions, organizing awareness programs. So and also addressing linking with the available resources also will be done by the psychiatric social workers. So the role of psychiatric social workers are enormous, and we need to develop various skills in the field of psychiatry if you want to work as a successful psychiatric social worker. Okay, so this is one of the things. This is all about that. And PSW plays a crucial role in addressing the mental health needs of individuals, families, and communities, and have holistic approaches to mental health care. Along with PSWs, faces many challenges like lack of accessibility, stigma, and misconceptions. Addressing the challenges requires ongoing professional development, supervision, and for psychiatric social workers. Efforts to improve mental health systems, reduce stigma, and increase access to care are essential in creating a supportive environment for both practitioners and those seeking mental health services. Okay, so thank you very much. Now the session is open for the discussion.
Thank you so much, sir,
Yes, sir.
for your nice presentation, and it is really elaborative. You covered the history of psychiatric social work and put all statistics over the time how it has been uh, developed, and now where are we. So it is really a very nice presentation, and in detail you have covered almost everything in your presentation. So thank you so much for your presentation, and you also connected being a social worker, how to what role we must play, and how to deal with such a delicate issue or very sensitive issue like psychiatric issues. Thank you so much. Now I request all the participants, if they have any doubt or any question, or if they really want to contribute anything to this presentation, so they are welcome.
There is one question from Pratima Patnaik. She has asked, is there any difference between a psychiatrist and a PSW? Yes, as I said, this is the field where we have multidisciplinary team. In that, psychiatrist is a person who completes MBBS and does either diploma in psychiatry or MD in psychiatry. So basically, a psychiatrist is a trained medical person. He is a psychiatrist, and psychiatry is a branch of medicine which deals with the mental health issues of a person. Okay, whereas psychiatric social workers are the persons who are qualified social workers, basically who have done their masters and who are working in the field. As I said, those in India now, it is compulsory to have MPhil in psychiatric social work, which is a 2 years course, which is offered after masters. Okay. Until 2017, we did not have that mandatory, but now after 2017 Act mandates that. Okay. So in MSW we have specialization medical and psychiatric social work. So basically, psychiatric social workers are who have done masters in social work and subsequently specialized in the field of psychiatry to extend the psychosocial interventions. Psychosocial interventions. Okay.
So another question asked by Rohit Gupta. Basically, he wants to ask how we can.
Yeah.
Sorry,
So role confusion. Yeah. See, this is what earlier, wherever if you see multidisciplinary team was there, and where whoever has got training from those institutions, they will be aware of the role of psychiatric social workers and other team members, the clinical psychologist and psychiatric nurses, occupational therapists. Okay, so there will not be any confusion. So basically, the training and orientation which they get is very clear. The psychiatrists are trained doctor. They will also get training in the field of in psychosocial interventions. but basically their training is in medicine. Okay, and the other team members, clinical psychologists, they will be trained in clinical assessment and interventions, especially in some of the interventions. Same way, psychiatric social workers are trained in the field of social work, and they will be trained in the field of psychiatric social work to extend their psychosocial assessment, psychosocial interventions, and psychosocial rehabilitation. Okay, sometimes the field itself is like that. For example, psychotherapy will be done by psychiatrists also, or psychiatric social workers and psychologists also, if they are trained. Okay, but they will be aware of the roles. One person cannot be done everything. For example, if you want to have a successful cinema, so one person cannot be the director, producer, hero, right? So we need to have team. It is like the concept is like that only. And this is the field which requires different people who are specialized in their areas.
So again, Pratima,
Good evening.
another question. One minute, Jyotsna ma'am. What should a psychiatric social worker do if the patient will not comply with his or treatment plan?
Yes. See, this is what actually the treating team generally they will see how the patient is there. If they are not complying, okay, that's what medication compliance. If it is there, then they will do the assessment. We have to do the assessment and see why that compliance is not there. So we have to see the reason, then we have to address. So for example, if the hospital is very far and they are not getting medicines, and it's very difficult to come and get the medicines. So that is the one reason. Then we have to see how alternatively it can be done. For example, now under DMHP, so now each taluk hospitals also empowered to give medicines. Okay, so that we have to see. Same way, if they have other issues, that has to be addressed. For example, if patient feels that I don't need to take medicine because I am perfect, right? So they will be there. They will be having that. Then he is not having insight. So we have to explain why the importance of medication and how long it has to be taken. So what is the effect if he is not taking? What would happen? So we have to make him to understand. Again, as I said, we have to see the person, and based on that we have to decide.
Yes, very rightly it's said. Actually, when there is no any issue with the treatment or the patient is not following the process. So again, being a social worker, we have to follow the casework process. So
Yeah.
which is involved with continuous follow-up.
Yeah.
Whether the
So
things
here
are
one more question asked Pratima. She is telling during session if patient is struggling with substance use, how to address. Okay, see again this is clinical, or we have to see first. Basically, we need to assess whether the person is socially using or user, is he abusing or is he dependent. If the person is just socially using, then the treatment or interventions will be different. You have to explain to him about the difficulties, or if he continues to use, what would happen. For example, health complications and drinking and driving, meeting to accident. So, and also how it affects his other performance, that has to be explained. If the person is dependent, then definitely needs treatment, and he has to get admitted and treated for that. So we need to see. Okay, that has to be done. For that, if the person should be motivated. Is he really want to quit or not? That has to be assessed. Okay. If the person is not really motivated, then we have to do motivation enhancement therapy, and he prepare him for receiving or seeking treatment. Okay. Yeah.
I hope Pratima, you have got your answer. Now I request Jyotsna Das, please ask your question.
Good evening, sir. I am Jyotsna Das. I am attending this session from Paradeep. I have done my MSW from Utkal University DDCE, and I felt that from paper one of semester one till the last, whatever we have studied, you have summed up in one session. So my question is, now the psychiatric get into the information and will know about the health of the person only by questionnaires, or there is any other means to know about it?
See, one is interviewing, another one is observation, right? Another one, you have to interact with the family members, right? Basically, if you want to understand, you need to collect information from multiple sources. Okay, so only one thing is not possible. See, that is what is the difference between normality and abnormality. I did not discuss this, okay, because time was short, so I wanted to focus only on psychiatric social work and overview. So normality and abnormality, there is a very minute gap. There is a difference between normality and abnormality is very minute. Okay, to assess that, we need to use multiple sources. That is why only not only psychiatrists, why there are psychiatric social workers, why there are clinical psychologists and all, to make sure that the proper diagnosis will be done. Then only you can start treating. Okay, so if, as I said, not only interview is also one part. We need to use other things also, like observation, how the person behaves, and with family members, interaction with that is why in psychiatry interviewing, not only asking questions, what is his what is his behavior. Okay, that also will be observed. Is he making eye to eye contact? How he is dressed up? Is he cooperating with the clinician? Right? All those things should be taken. That is why it's all complete assessment.
Sir, we have so much of problem because when we follow up and we feel that yes, the person is recovering, at that time even a minutest disturbance in the family reverse the process so fast. In this case, what is to be done? Because family also need we need support from the family more than actually from only us or from the medical uh, side.
Correct. That is why treatment, whenever we speak about treatment in psychiatry, that is why we talk about comprehensive treatment. So which not only includes individual, his family, again, if requires his community, working place. So all those things are required. That is why we need to work with individual to enhance his coping skills. Right. At the same time, family support also required. We see that most of the time family if not supporting, definitely the patient will get relapse, isn't it? So again we have to call the family and we have to work with the family.
Yes. Thank you, sir, to address my
Thank you.
questions.
So Rohit Gupta has another doubt.
Yeah, please.
It is my humble request to all faculty and professionals of social work or psychiatric social work, please come up together to raise your voice and recognize. Acha. So basically, he has some sort of suggestions to strengthen the association. Of course, we all are struggling to build an association in India, and in Odisha also we are facing a lot of challenge. When last time actually few days back we had our association meeting and very few people attended that meeting. That is the situation of social workers in India and Odisha. But in that context, I can say the people staying in North India are much better. People like you, because your association is stronger. Social work is being taught in almost all universities and colleges. But still, Odisha and in some some states like Odisha, we are facing a lot of challenges. This is a small initiative in that context to bring vibration in social work. And actually, we really need your supports to strengthen our fraternity and our association, so that people can get benefit out of that. So the same question, sir. I have also one question in that context. Very rightly, you told about kingdom of evils and social diagnosis by very Richmond. Many people, they has a very psychiatric social work has more or less very uh, strong connection with social casework, as you have very rightly mentioned. But in other part, we can see the contribution of India is both male and female in terms of disease and in terms of death, whatever you are saying, it is almost more than 25%, as you have rightly highlighted in a slide. But when we are talking about infrastructure, specialization, and doctors or specialized social workers, the contribution is not that impressive in case of India. So what is your suggestion? What can be as a social worker, what do you suggest the immediate plan of action that must be done so that we can mitigate that issue? Because 25% is not although we know India is the highest populated country in the world, but 25% is not that small.
See, if you see the fund allocation from after independence, because of various reasons, budget, if you see, it is limited. In India, it's limited to health. I'm talking overall health. In that, again, mental health, it's very less. Okay, so that was the one of the, because you need resources. Once you have resources, you can create. So till recently, we had only few institutions. For example, if you want to do MPhil, if you want to get training in psychiatric social work, you had NIMANS, CIP, RINPAS, right? And only these 3-4 institutions were there. But later, other institutions have been added because of, as I said, 11th plan and 12th plan. There was effort and they added. Now, around 22 institutions, they are offering MPhil in psychiatric social work. First one is manpower development is very important. Okay, so that is happening, and as you said, we teach social action. Yeah, community organization we teach, but somewhat very sad part is we could not able to organize ourselves in India, right? Social workers, and even action part we have missed. I think action part we have missed. So hope now, because now we have associations have come up and now people are working. For example, we have got now medical social work separate association has come, psychiatric social work separate association has come. Again, we have human resource management, there people are doing good. And for education and other things, we also have got good association like NAPSP and SPSW. Somewhat now we are also we have also picked up and we are going ahead. But that we need to strengthen and we need to work more on that, as some of the youngsters and all of you said. We need to work locally. We need to make I think we need to mobilize ourselves and work towards strengthening this. Definitely, whatever we are doing it, we need to accelerate that. So I think we all need to play a vital role in that. And now one important thing in mental health, especially psychiatric social work and medical social work, psychiatric social work now fund government of India is focusing more on that. And because of that, as I said, number of institutions increase. Now manpower also is increasing. Now you have Rohtak, MPhil they're offering, and again we have Himans, Katak also they have started, Goa, Karnataka also other institution has come up. So these are the avenues for our psychiatric social work. Okay.
Thank you, sir. Actually, no, what I can see from your CV, I should not say, I don't know whether I should say it or not, but your CV, I found is it one of the very impressive CV, and very few social workers are found like, no, having a complete balance of research, education, and no administrative work. You are associated with a number of associations. So definitely being a social worker, I expect many things from you, because at national level and state level, no, you can really do wonder, and that will be really helpful for all social workers like me. So in that respect, not only psychiatric social work in general, you can now contribute many things, and in future definitely we'll expect that from you. Thank you so much, sir, for this answer. And now I request Rakesh, please, Mr. Rakesh, you can ask your
There is one question: how spiritual social work practice help to cope from psychosocial problems? See, definitely, mental health is directly interlinked with spirituality. Okay, spiritual social work definitely contributes for our psychosocial well-being, and studies clearly shows that if we are spiritual and so many issues have been taken care of, because you will be reality oriented and you will develop coping skills, and you will be empowered to handle the issues. Okay, there is definitely spiritual social work has its own role in the field of mental health, especially in the field of mental health. There is no compromise. So that is what, if you see the Bhagavad Gita, if you see the other texts, definitely they will give us the strength. And in a way, we also say that this, Bhagavad Gita is one form of psychotherapy in mental health. Okay, Indian, mental health, Indian knowledge system, as people are working on that, and it has been working since a long time in the field of mental health. Okay. Thank you.
Hello, sir. Good evening. I'm Rakesh.
Yes, please.
Can you switch on your video, please?
Sir, I am unable to. I'm using mobile.
Okay,
Sorry.
okay, no problem. If possible, you can. Yes,
Yeah.
ask your question.
Yes, sir. Sir, it's my suggestion and request. So, I have been seeing the social work profession from past 4 to 5 years. So we are just following the syllabus which we have, like a theory and practice. But we are not including any kind of artificial intelligence and upcoming versions of virtual field. So it would be helpful for our profession to grow further. And so if you want to recognize ourselves, so this media and this kind of the technologies will help us to improve our social work profession, sir. And and it's my request.
Thank you, Rakesh. Thank you. See, this is what actually we need to pick up. So this is what youngsters can able to throw light. What is happening? How we have to integrate artificial intelligence. So it is a very wonderful suggestion. Definitely, we need to work on that. Recently, I have seen in Tumkur University, one professor has given a topic on virtual, this artificial intelligence in social work. One PhD scholar is working on that. So you have rightly pointed out, we need to adopt and we need to use actively.
Yes, sir. Thank you for accepting. Sir, one more thing. So these days, the availing social work education is substantially decreasing because everyone practicing same thing of the theory and practice. No creative things are happening because I am seeing in other universities which are located in North Karnataka and other sectors. So the students are joining to social work. It's substantially decreasing, sir. So I think, as per my knowledge, we have to promote in such a way to, like, everyone has to look into our social work. So it's because social work is need to understand everyone, and it's important, sir. I think.
That's true. You're right, Rakesh. Yeah.
It is one of the major issue throughout India, not in Karnataka or any part. Uh, Maybe we have to focus on more on that. Actually, what is the reason why actually the number is gradually decreasing? The quality of education is also decreasing. Private parties are now playing still a very crucial role in providing social work education. So they are basically focusing on profit and income. That has become one of the major challenge before all of us. Being sensible social worker, we have to think on that, and we have to put our efforts in that respect. I can say your contribution will be more, since you are leading and being a part of all national level bodies. So major changes in the policy level are required, and it is high time for that only. As I understand.
Excuse me, sir. Recently, we had yesterday a train accident. So, Tata Institute of Social Science alumni have taken the responsibility of rehabilitating and sending the patients who are treated or in a verge of treatment at home, send home. But then, sir, we face so much of problem because certain Bengalis and Tamil people are speaking so remote language that no one is able to understand. So here I felt what Rakesh ji told, if we have any kind of such kind of artificial intelligence use so that we can rehabilitate. Today, 5 members from Paradip had gone, consisting of one Tamil, two Bengali, one Odia and one Hindi speaking, so that we will help them to place them to the town because their languages are not understood. So this, I think, technology help is now badly at need in order to give even the minimum what is required during emergency.
Correct.
Thank you, sir.
Thank you, madam. Thank you.
So any other question? We had a long discussion, since sir, your topic is very important and very sensitive. If any question anybody is having, they can raise your hand or text in the chat box. I think there is no more question. Okay, thank you so much, sir. And I think 1 hour session or 1.5 hour session is not enough to cover such a huge issue. So in future we are also planning to organize session on particular theme. So at least 3-4 session can continue for on a particular theme, so that people can understand in detail about the particular issue. As you have very rightly mentioned, multi psychiatric social work requires the intervention of multiple functionaries, multiple specialization are required. How that can be connected and how the disease can be cured. So that has to be understood by every social worker, and particularly the psychiatric social workers, those who are inclined to work in that field. Before working, understanding the issue and having the knowledge, adequate knowledge to deal with the issue is more important, and that can be possible if more number of such sessions can be organized, planned and organized. And actually in Odisha, what I have seen, psychiatric social work, except Cuttack, there is no specialization in other institutions. And the issue is not like students are not interested to study it. There is issue with the supply side. There is no specialized faculty to teach that subject.
So true.
And many people, even many students are bargaining to have such specialization. Those who really understand the importance and the future of such subjects and such specializations, they really bargain, but still they cannot get successful in their to opt for that specialization. In some institutions usually pressurizes based on their available resources, only they offer the specialized topics, and so that is one of the major concern actually. Instead, without creating supply of such specialization, it is very difficult, in my understanding, to cover throughout India such a nice profession, such an important profession, and we all know it is the need of the hour to actually focus on that. Being social worker, if you cannot fulfill our demand, it is very difficult to give justice to the people. So it is the time to think on that. Thank you so much to put light on us. Basically, I was also not that much aware of psychiatric social work, and whenever I heard about social work, psychiatric social work, the only thing came in my mind is cinemas. Apart from that, I really don't know anything. Unfortunately, I am also connected with some of the South Indian WhatsApp group associations in the name of NPS 1, 2, 3, 4 like that, and in some of the association I am a member of that. So usually I found some updates regarding psychiatric social work. Some people basically know whatever information it come from South India if it is about psychiatric social work.
No, you can wait. Now from Cuttack also it will come.
I know actually in Cuttack there is no MPhil course is being offered on psychiatric social work. All that.
You can encourage students to take. You can encourage students to go for MPhil there, so that they will also explore some of the new areas.
Exactly. It is required, sir.
Yes.
Very few people actually know there is no such provision in Cuttack.
Yeah.
Although I know, but very few social workers know there is a provision. So we have to do that.
Yes.
Thank you for your time, and I know actually the busy schedule you have. Every time whenever I call you, sometimes you are traveling, sometimes you are busy with a lot of assignments, and really we are really thankful to you actually. From your busy schedule, you actually spare time with us and presented such a nice topic, and in detail you covered everything. But future, definitely I will ask for your support and help to organize special lecture sessions on psychiatric social work, at least for 3-4 sessions.
Yeah. Thank you
so much.
very much. Thank you very
All
much.
the audience.
I thank all the audience for attending and making use of this session. I also thank Pradeep Sahuji for giving me an opportunity. I look forward to work in future with you. Okay. Thank
Our
you very
pleasure,
much.
sir, to have you. It is our pleasure to have you. Thank you so much, and good night. Again, we will meet in the next Saturday at 6:30.
Yes. Thank you.